and welcome to Pharmacy's pharmacy teaching videos. These series of videos are focused on minor ailments, so common conditions treated with over-the-counter medications and advice, and today's topic is pain relief. Pain can occur due to injury or disease, and it's very much a subjective feeling where the severity can vary from person to person. Often a pain score is referred to, and this is where you ask a patient how much pain they feel like they're in on a scale of 1 to 10 in order to assess the severity of their pain and compare their scores pre and post treatment to see if their pain is getting better or worse. Pain scores are also used in hospital. There are two types of pain: acute pain and chronic pain. Acute pain is transient, and with treatment of the cause or short-term pain relief, the pain will disappear. Chronic pain is intractable and will need regular analgesia to control it, so this is often where you see prescriptions for painkillers. Examples of pain seen in community pharmacy include headache, toothache, musculoskeletal pain, and period pain. Moving on to treatment options, the three main over-the-counter analgesics are paracetamol, ibuprofen, and aspirin. All three are equally effective as analgesics with no marked differences between them, and they're equally effective as antipyretics, so for fever, but paracetamol is not effective for inflammation. There are restrictions on the over-the-counter supply of these analgesics to ensure intentional or unintentional overdoses don't take place. Paracetamol overdose leads to nausea, vomiting, and eventually hepatic failure, which usually appears after 4 to 6 days. So the maximum quantity of paracetamol which can be supplied over the counter is 100 non-effervescent tablets or capsules, although in practice this would be 3 lots of the 32 packs. Although there is that maximum legal limit, as a pharmacist or dispenser, you would want to inquire why a patient would want to buy more than 1 or 2 packets at a time. There isn't a legal limit to how many effervescent tablets or paracetamol solution you could sell over the counter, but again, this would be under the pharmacist's professional judgment. The same rule also applies for aspirin in terms of quantity restrictions. Paracetamol, as well as ibuprofen doses for children, are often based on age, and sometimes weight if a patient is particularly small for their age. And it's really important to highlight these doses to parents to ensure that their child receives the correct amount of medication. Please check out our Facebook or Instagram post, which has a list of all the licensed doses for over-the-counter supply of paracetamol and ibuprofen. Also, please be aware that the BNF does have doses for those under 2 months old for paracetamol and those under 3 months old for ibuprofen. However, these would be unlicensed, so not for over-the-counter supply or recommendation. If patients are taking other over-the-counter preparations containing paracetamol, such as cold and flu preparations, they also should be advised of the maximum daily dose of paracetamol. Paracetamol is often the best first-line treatment for pain, as it can be given to all patient groups, rarely causes side effects, and doesn't have significant interactions with other medications. Moving on to ibuprofen, this is associated with adverse GI effects, in particular GI bleeds and irritation, so should be avoided in the elderly. GI effects are minimized by taking the medication with or after food. It also should be avoided in the elderly, as this patient group may have reduced renal function, and ibuprofen can impair renal function further. It should also be avoided in patients with a history or active peptic ulcers, patients with renal, cardiac, or hepatic impairment, asthmatics, and in pregnancy, as it can delay labour. NSAIDs may also provoke renal failure when taken in conjunction with diuretics or ACE inhibitors, and they can also increase lithium levels, so watch out for those medications. Like paracetamol, ibuprofen doses are age-based, as we mentioned, so please refer to our post. Moving on to aspirin. The association of aspirin with Reye's syndrome, which is a potentially fatal neurological condition in children, has led to its restriction to patients aged 16 years and over. It has a higher incidence of GI bleeds than ibuprofen, so should also be avoided in the elderly and those with a history or with active peptic ulcers, as well as in asthmatics, as in some asthmatic patients it can precipitate shortness of breath. Due to its antiplatelet effect and risk of GI bleeds, aspirin should also be avoided in those taking oral anticoagulants or who have an increased risk of bleeding. Like ibuprofen, aspirin should be avoided during pregnancy, particularly during the 3rd trimester because of possible bleeding and delayed labour. So paracetamol is the only over-the-counter painkiller safe for use in pregnancy and breastfeeding. Codeine and dihydrocodeine are available over the counter in combination with other analgesics. These carry extra warnings due to the risk of overuse and addiction, so should not be used longer than 3 days. They are restricted to the indication, short-term treatment of acute, moderate pain that is not relieved by paracetamol, ibuprofen, or aspirin alone. It strictly cannot be used for any other purpose when being sold over the counter, so can't be used for sore throat, cold, or cough. More than one pack should not be sold at any one time so as not to undermine the pack size restriction and POM status of larger packs. Also, they are not licensed for sale to children under 12 years. The low dose of opioid, so 8 mg of codeine for example, that is contained in the majority of over-the-counter compound preparations isn't enough to provide significant pain relief, as usually the therapeutic analgesic dose of codeine is 30 mg. However, at subtherapeutic doses it can cause opioid side effects, in particular constipation, so this can be problematic in the elderly and as such it should be avoided in this patient group. Caffeine is a weak stimulant which can be included in some analgesic preparations to enhance the analgesic effect, but this is usually with products containing 100 mg of caffeine or more. Side effects include nausea, headache, and insomnia, and there's also a risk of habit-forming effect, as you would expect with caffeine. And finally, referral criteria. So refer patients who appear to be abusing analgesics for a routine GP appointment. Young children who don't appear to have responded to maximum doses of analgesics for their age. Patients suffering from pain that is more severe than what they've previously experienced. And patients experiencing pain which is increasing in severity over several days with no apparent reason. So that's all for our pain relief video. Please make sure to like and subscribe to our YouTube channel for more videos, and of course follow us on Instagram and Facebook for posts and quizzes. Thank you.